Hello and welcome to the Holon IQ 2022 Global Impact Summit. My name is Vernon Baxter. I'm the VP for Health at Holon IQ. As part of our Africa Summit, I'm delighted to be joined today by Chibuzo Opara, the co-founder and co-CEO at DrugStock. Welcome, Chibuzo.
Thank you, Vernon. It's great to be here on this platform. I'm looking forward to an exciting conversation.
Fantastic. So what we're going to do today is we're going to talk to Chibuzo about DrugStock and hear the story of his business and the market that he operates in Africa. And then we're going to talk a bit more about the market more generally, and then have a look forward to how the market is evolving in the region and kind of what comes next for DrugStock, but also for the sector. So Chibuzo, I would love to begin by just asking you to share with our Global Impact Summit audience the nature of your business and also how you came to found DrugStock and where the inspiration for the business came from initially.
Thank you, Vernon. So DrugStock is a data-driven supply chain pharmatech company that bridges the gap between the supply and the demand for pharmaceuticals in the last mile. What we're seeking to do is to democratize access, improve the pricing for pharmaceuticals, and to remove the fragmentation and improve the quality that exists in that space. DrugStock was birthed about 5 years ago. My co-founder and I, Adham, we had at the time been struggling with sort of accessing pharmaceutical products in some facilities we were managing. Both of us had come from medical backgrounds and had faced challenges trying to get access to products that our patients needed. And one of the things we had done at the time was, set up this procurement platform for about 20 facilities. And we found out that we could offer, some efficiencies and gains and also create bulletproof supply chains with this thing. So, we did what any two entrepreneurs would do. We expanded the platform, digitized it, and, failed miserably in the first year. We pivoted the model. And, right after we did that, we started growing 300% a year and scaled up to where we are now, where we service just over 3,000 healthcare touch points for their month-to-month pharmaceutical and health commodity needs. It's been an interesting journey, one with, blood, sweat, and tears, but the rewards have been, something that, if I look back on, I'm quite happy with, where we've come and how the industry has, embraced this innovation.
Yeah, and I'd love to come back to some of the things that you learned from that initial failure and the pivot in the model and to understand a bit more about that. But Chibuzo, it would be great just to understand a bit more about the context of the market that you were operating in when you launched into the business. You talked about some of the issues and the problems that you'd experienced and your co-founder had experienced in your kind of medical careers. Could you maybe kind of paint a picture for what the, I suppose, the pharma supply chain issues around kind of counterfeit medicine and veracity of the items that you're dealing with healthcare procurement in Africa? Could you maybe, when you started, what was the landscape like?
So when we started, the landscape was quite fragmented. And this fragmentation led to a few challenges in the space. One of them was the influx of counterfeit and substandard medication. As far back as 2020, it was said that the market was 50%, beset by these issues. It's dropped somewhat, and you can have issues with counterfeit or substandard medication in sub-Saharan Africa, anywhere between 10% to 30%, depending on where you're buying your medication from. This fragmentation, causes the proliferation of certain perverse supply chain incentives and initiatives. a lot of middlemen that drive up the prices. Prices go from an average of 2 to 64 times international reference prices, and issues around access. Now, because you have such a fragmented system, what typically happens is that when a healthcare provider or a patient is looking for a product, now these products sometimes it's difficult for the individual looking for it to find out where they actually exist, even though these products may actually be on the market, because these supply chains are not very standardized and things like that. So, with our technology platform, what we've done is basically build a sane system on top of this chaos, allowing people, patients, healthcare providers who are searching for access to unique sources of products, and just digitally connect them, and they don't have to deal with that chaos anymore. That's what we've been doing in the last 4 to 5 years, and it's been an interesting ride.
Yeah, and obviously I can understand the problem, and how necessary it is to sort of address that for the sake of consumers, for the sake of patients, for the sake of clinicians. But in terms of how you went about it, was there anything performing this kind of function in the market previously, or did it take a bit of a mindset change for people in the market to kind of embrace technology in this area?
So I'd say that Sub-Saharan Africa traditionally is quite plastic in terms of adopting new innovations around tech. Obviously, with the rapid digitalization in healthcare that happened after the global pandemic, that you would say is one factor that has driven a lot of adoption of these digital health technologies in the last couple of years. But traditionally, people are looking for something that can bridge their everyday problem. Remember that, with the lack of or broken infrastructure that pervades the system, somebody coming up with a digital infrastructure that leapfrogs these infrastructure barriers is able to meet the patients and the healthcare providers in their areas of need, thus providing them a genuine alternative to what they don't want on the market. And that's one of the things that we've been able to do with our platform, and focusing on what our clients want and those needs, including their future needs, which they might not yet have identified, is one of the things that have endeared us to our healthcare providers and literally enabled us work perfectly with them.
Yeah, because I'm guessing that one of the consequences of you using a kind of digital first approach to information like this is that it allows you to understand patterns, understand kind of healthcare insights through the data. And is that something that you've kind of noticed, as obviously with your kind of medical background, you can see that this isn't just about supply chain, it's also about understanding the clinical landscape as well?
Obviously, with my clinical background in the understanding of the disease health burdens that affect society, seeing it play out real time digitally in front of you on a platform is, nothing short of a doctor's sort of, crystal eye box, where you're able to say, how do I link this disease group to this supply chain? And what we've been able to do, in addition to using efficiencies of scale to drive prices down, is we've been able to use specific targeting to ensure that, there's a lot of expansion and access to healthcare needs and meeting healthcare needs with healthcare products that our partner manufacturers have been able to work with us to do. So I think in the last couple of years, a lot of these digital experiences for our clients have been accelerated as more and more people move online and provide more access to these products. I think in my capacity, I'm just excited to be one of the people who are driving this change forward, because it is important to, as we all understand, as the world transitions from a small, fragmented communities to one of a globalized, force or globalized peoples, that you see that everybody is sort of understanding that these needs are necessary and global, and people want them, they crave them. And there's not like listening to the same broken rhyme every day that, oh, there's no resources to do this or that. I think it gets tired. That speech gets tired for most people. And what we are trying to do is to say, hey, listen, there's a lot of inefficiencies in the system. Digitally enabling access allows you to match patterns, thereby transferring those, creating value from inefficiencies that you wipe off using digital distribution.
And just coming back to Drugstock as an organization, and in terms of its own kind of growth plans, I know that you raised money relatively recently for the platform. What is your sort of expansion and kind of growth ambitions for the business?
So, I mean, the thing about us at the company, we are looking to expand this innovation across the entire sub-Saharan Africa and similar clients. And we continue to work and reach out to partners who share similar visions and similar missions. And for us, it is very important that the same kinds of value that we've created in the locations that we work with, we want to expand that. So we're looking at expanding out of Nigeria. Obviously, we're looking at expanding across Nigeria too, but up and out of Nigeria into similar clients, Ghana, Kenya, Tanzania, and the like. And for us, these markets face similar challenges that we face. And we feel that using our economies of scale and using our technologies that we've developed and honed over the last few years, we could bring them similar gains in efficiencies and expand access for healthcare to patients who, a lot of Africa is living, a significant majority of the population is living below $1 a day. And there are two ways to solve health access for that. You can either say, hey, I'm going to increase everybody's well-being to more than $1 a day, in which case you might have inflation because then the products also rise prices. Or you can just be like, I'm going to expand access, in which case $1 a day is enough to get the healthcare that you want.
Yeah, I'm interested in that point about the landscape of healthcare in Africa. I mean, obviously with your business, you have quite a unique view of how the sector is developing and evolving. And I know that you already mentioned the kind of the impact the pandemic had on the sector, almost like a catalyst in terms of digitization. But how would you summarize the state of healthcare in Africa generally, before we kind of dig into your particular aspect of the sector?
I mean, the truth of the matter is that with healthcare, I don't want to start throwing out stats. Everybody's familiar with the sad state of infrastructure, the huge disease burdens, the infectious disease growing, all of that. Suffice it to say, though, that in Africa, it's not one story everywhere. So when you go to the urban areas, healthcare is definitely much better than in the rural areas, but then you have a population moving from the rural areas to the urban areas, and you have the increase of disease burdens in certain target population groups. So it's worth going beneath the hood when it comes to, expatiating the African health story. And, there's a lot of things I could point out to say, hey, this is a bit different from what we thought. Say, for instance, you would see maternal mortality in certain populations becoming, less crazy than it would be in certain populations. And then you have other populations where the maternal mortality is just insane, mind-boggling. And I think what digital health systems provide is the ability to sort of approximate first of all, provide people the insight real time of what is happening. And supply chains actually tell us a lot of what is happening, because one instance was that when we started reacting to the pandemic initially, early on, we were able to anticipate that supply chains were getting into trouble months ahead of that. And I remember informing a few people in the Nigerian CDC at the time that, hey, this is what we're seeing. These supply chains are drying up, and these were. Yeah, so for us, basically, right, with Drugstock, we're able to, predict a few things just by seeing the data that we were looking at across these data points on the supply chain in different areas that we service, and along the supply chain, working with manufacturers and all that. And we're able to provide this information to some of the local and federal authorities with regards to the healthcare system. But at the end of the day, one of the things that a digitized supply chain is also able to do is to react faster, share a lot of these benefits in value that we accrue to the system by optimizing out inefficiencies, and share these to patients in terms of meeting their quest for more accessible and more affordable healthcare. And that's something that we sort of pride ourselves as one of the greatest things that has come out of our innovation, and one of the things that we continue to push.
Yeah, and I'm interested in terms of that, I suppose how it impacts on outcomes, because obviously with more traceability in the system and more ability to follow the data through from a clinical perspective, I'm sure that helps from a system perspective understand how effective treatment's been, where the identifying the areas of further need, and that must be a key element of your proposition, I would imagine.
Yes. So we're first and foremost a data-driven pharma tech company. We work with our suppliers. Obviously, a lot of the data we collect is metadata, right? We don't get into patient data. That we leave for the clinicians and the physicians and the pharmacists. But one of the things we're able to do is to work at the level of metadata to be able to, enable our partners first and foremost, provide better services to their clients. We give them timely and much needed valuable information that, because they're operating in discrete units, might not be able to see this meta evolving phenomena. We also work with other stakeholders in the system through our open API platform, providing a lot of this information for free for them to take decisions and make better judgment calls on certain things that happen. I think eventually, right, at the end of the day, one of the things that all over the world is becoming a reality is that with the increased healthcare spending, for instance, in the Western countries, and the increased medicalization and realization that infrastructure gap cannot be surmounted by just cash in the emerging countries, what you're beginning to find is there's this singularity sort of approaching in healthcare where it's like, hey, how do we do more with less? How do we provide value and access and expand healthcare for an increasing global population? How do we solve challenges using digitalization? What opportunities does digitalization hold for us? I think we're just scratching the surface in terms of digitalizing the healthcare space. Recently, countries like India and Nigeria have started to put in regulation around access to product. I think it was starting to become a wild, wild west, and I hail the authorities in doing a lot to streamline what the digital expression of a digital healthcare company can and can't do, and what you can often provide for your patients. And I think over the next 5 years, you're going to see a very healthy, robust digital space that continues to challenge old thinking with regards to access to healthcare for patients.
Yeah, it's interesting to think if you're looking at the market in a kind of mid to long term in terms of the consequences of this period. I mean, obviously the COVID was very difficult for many healthcare systems globally, was particularly difficult for Africa. But when you look at the silver lining of further digitization and changing attitudes, there's a kind of potential where the market could see some real transformative period. And Chibuzo, if you were to kind of look at your business and the market that you serve, and if you were to look kind of further ahead, how, I suppose, ambitious or optimistic are you about how technology can affect change in the market and lead to better outcomes, increased access, and maybe helping to kind of correct that cost curve?
So I think we haven't even seen the biggest impact of technology in healthcare in Africa. I think what has happened in the last 5 years is that sort of technology sort of, fought its way to the front of the healthcare intervention space. One of the most exciting things that a lot of people don't realize with healthcare technology is that if you look at the traditional route or speed to market of healthcare interventions, it's typically 10 to 15 years.
Yeah.
So healthcare products, the CT scan was like 30 years before it came to mainstream market. Pharmaceutical products, medical interventions. But one of the craziest things that happened in the last 2 years was that digital health products now hit the market in 6 months. And a lot of them, and what has happened is that regulators have sort of created this, whether knowingly or unknowingly, have created this set of interventions which they're able to regulate without necessarily impeding the speed to market of these products. And so over the next few years, if you think about it, it's just common sense. You're going to have more products hitting the market, and the ones in the market are going to keep improving. Solutions like ours, for instance, are becoming more mature. I remember 5 years ago when we launched the product, everybody was laughing. They were like, what are you talking about? Nobody buys drugs online in Africa. This thing is something for the West. It even failed in the West. This is never going to work. And now it's like people are talking about DrugStoc like we've been around for like a significant amount of decades. They compare our brand with brands that have been around for a long time. And this is not because of the fact, it is not just the fact that, we pay a ridiculous attention to what the client wants. It's not just that, even though I'd like to say, that's the reason of our success, but it is also a result of the yearning of people that, they want something different. Like what the status quo is not enough. And these are the realities of our time. It is inevitable that this innovation continues to transform the African healthcare landscape and other similar times too.
Yeah, I think that's one of the kind of positives for digitalization is that in areas that don't have the same infrastructure as maybe some of the kind of more mature sectors in the West, there is the potential to, I suppose, leapfrog or cut out some of the inefficiencies and some of the problems inherent in kind of other systems. But Chibuzo, that sort of brings us to the end of our allotted time. I just want to thank you on behalf of everyone who's tuned into the Holon IQ Global Impact Summits for you taking the time to tell us about Drugstock and to tell us about your experience in the market. Sounds like it's going to be an exciting few years for you and your team as you continue to grow in the way that you have done over the past 3 years.
Thank you, Vernon. It was great to speak here. Thank you for having me.
Thank you.